in the same light of a community collaborative and looking at what Williamson County has and what we have, one thing we do have in common with Williamson County is the fact that we have fast-growing senior populations. So our older adult populations are about comprised of 25% of our population. Fayette County is a little bit different than Williamson by the fact of the projection growth. The age 65 plus population is projected to grow an astonishing 450% by 2040, which means access to care is all the more critical. When I was with Fayette Senior Services, and now I have an expanded playground with the hospital, and working with their older adult services program, one of the things that was critical in aligning partnerships was access to care. So I want to talk about what Fayette County has as far as non-emergency medical transportation. What we have is very few choices. There are very few options to get to the hospital, doctor's appointments, dialysis, etc., when you no longer drive a motorized vehicle. And as much as I live in Peachtree City and love golf carts, they are motorized vehicles, and they're not really good options for older adults getting to health care. And there really are, because we don't have those choices, it makes it very challenging. So when you think about, Medicare does not pay for non-emergency medical transportation. So if you are wheelchair bound and have to go to dialysis 3 days a week, one round trip is going to cost you about $80 to $100 each. So Fayette Senior Services has a partnership in the county. We are a public-private partnership with Fayette County government. Fayette Senior Services, and I say we because I was just there 90 days ago. As a nonprofit provider, Fayette Senior Services does provide supportive services to the older adults under the Older Americans Act, and one of those is transportation. So we do have a very successful public-private partnership in transportation. We also have, Fayette Senior Services also partners with Piedmont Fayette Hospital as well with their older adult services to make sure that seniors have access to care. It's limited fund sources, primarily federal, state, local government, grants, private pay, and cost share contributions. I'm going to have to get a little closer. Although we'd love to be serving the total population like Williamson, Williamson has a transit authority. We do not. Williamson offers fixed route transportation. Fayette Senior Services does, but it's primarily to senior centers and back. So we are, in Williamson County is dealing with total population. Fayette Senior Services Collaborative is only dealing with the 60-plus population primarily. So that it offers fixed route, like I say, to and from senior centers, on demand through the door. And that's really important. That through the door wait time access is very important. When you think about if you want to put your mother, you know, in one of the vehicles to go to the doctor's office, a cab is going to leave her out the door. Fayette Senior Services provides through the door transportation. We'll wait and bring that person back home. Fayette Senior Services also crosses jurisdictional lines. Most of your providers in aging service transportation do not. So you have to stop at that door. So we do have that flexibility, but it's that flexibility that's important. Williamson County's has on-demand, but it's to the curb only transportation. So I think it's one of the quality things that we do provide in this community. Fayette Senior Services did a partnership about 5 years ago through the United Way and with Exceptional Ops to also offer to address the underserved population of the disabled adult population, 18 to 59 years old. We did that because there were absolutely no choices for that segment of the population to get to and from a workplace, to school, and to health care. So those are the primary focuses of, and I'm doing this again, I can't walk and chew gum at the same time. Those are the population segments we do serve. This is what we do in the community. This is what's so essential to this partnership. More than 16,000 trips provided to older adults in our community. Over 2,000 of those are wheelchair transports. And that's what's really important. I get asked all the time, well, why don't we just do a volunteer transportation program? Those are really good, and there's some good ones. The problem is when you are wheelchair bound. Volunteers generally do not have handicap accessible vehicles, so that's become the most fast-growing segment of the transportation provided. I think, Jack, if I'm right, Jack's on our Fayette Senior Services Board, we saw that grow by over 35% last year for wheelchair transport. 5 years ago, when I was with Fayette Senior Services, we had about 4 or 5 vehicles, and I think 2 of those, Chief Heaton, were donated by the Fayetteville Police when they were repurposed. Today we have 11 vehicles, and 7 of those are handicapped accessible. About a total of 400 Fayette County citizens are served, but this is what's most important when you talk about the health care issue and how to access health care. These are the most frequently requested destinations of the highest in order of highest demand. Rehab centers, physicians, hospitals, dialysis clinics, dentists, cancer treatment, and other health care providers. But more than 2,000 of those trips that Fayette Senior Services made were to the Piedmont Fayette Healthcare Network. And I think that really speaks volumes of the need in this community. And again, when you think about choices, there are very few alternatives that are flexible, affordable, and will really meet that need of that particular segment of the population. But if you take it a step further, why partnerships are so essential, Piedmont Fayette and Fayette Senior Services and others that are transporting our community are now having to broaden that scope, because if you have someone, for instance, going through Piedmont Fayette's Cancer Wellness Center for treatment or going back and they are not 60 years old, you have to be flexible. We cannot not make sure that need is met. So this is what we are doing in the community to improve access to care. And one of the conversations that I think we have to have, which is a great segue to the transportation discussion, is how are we going to address the need of having alternative options for transportation?
Let me say first, whenever you hear somebody in Washington talk about the cost of health care, they're talking about how much the federal government spends on health care. So that's not what it costs for us. So, I mean, when they talk about bending the cost curve, they're talking about bending what we see out of Washington at the national level, you know, how much they're paying out. For ours, it is going up. I mean, and that's part of the dilemma. What Cleveland Clinic, they're unique in a way because they started off that way. I mean, they were built, Mayo's the same way, where culturally, the physicians and they were all in there one together. That's what we're trying to get to, and we've seen that. A great example is with the Piedmont Heart Institute. 5 years ago, we had 3 independent cardiology groups, and trying to get them to come together to agree on what stent to use. If a heart, I mean, they all had their favorites. They all had this or that, and then even trying to get on, variation of care, standard order sets for how you treat a patient with MI. It just took too long, Now you jump ahead. Now all of a sudden they're employed. They're all in the same group, and the finances are tied together. They can decide like that. Well, we're going to go with this, and this is It's amazing how the dynamics change in ways. The same thing with the clinical guidelines and order sets, that they're more aligned with one voice, and then we're more aligned with them culturally. The difficulty is that we can't, as Piedmont, we can't afford to go and employ every physician. The money's not there, so we've got to find creative, collaborative partnerships with physicians and other entities that can, make them win-win. And the physicians are starting to see this because they're getting hit with the same reimbursement issues as well. But there's still a lot of competing priorities between us and the physicians as far as how we're incentivized. So.